gastrointestinal and genital urinary pathologies, and it could also give the insight regarding abnormalities among other systems. So the uh, first thing that you need to do is to check for the patient's medical record. This determines the scope of assessment. Okay, the needed necessary materials prior to the meeting the client. The first thing that I need is measuring teeth, stethoscope, or escalating the abdominal sounds, and pen to mark, and pen light. Okay. Now that I'm done preparing these materials, I'll be provide the hand hygiene. Okay, next, introduce self and verify the client's identity and ask how the client would like to be called during the assessment and establish rapport with the client. Okay, sir, good morning. I'm Geraldine Tinibagon and I'm your student counsel today. So, sir, may I see your response? Okay, sir, can you please state your full name
I am Chief
and your birthday?
August 1st.
So, sir, what do you prefer to call you?
Good officer.
Okay. Okay, so now I will explain to the patient the procedure. Okay, sir, today I'll be with you for your abdomen assessment. For today, I'll be needing you to remove the clothes so that I will be able to inspect and auscultate, percuss, and palpate the certain parts of your body. And will that be okay, sir?
Yes, it's fine.
Alright, so do you have any question or clarification, sir?
I don't have any questions.
Before we start the assessment, sir, you don't have to worry at all. This information that will be gathering today will be kept confidential. Okay. Okay, so you feel comfortable right now, sir?
Yes, I feel.
Okay. Okay, so after that, I will provide the privacy by closing the curtains and door before I proceed the assessment. Okay, now I'm done. So, sir, are you comfortable? Now I'll be interviewing the patients for a health facility to gather subject data that may reveal the patient's health concern. So, sir, do you experience any pain of your abdomen?
No,
Have you gone or undergone surgeries?
no,
Sir, this is first time in examining your abdomen.
yes,
So, sir, do you have any past health history, sir, like diarrhea or UTI?
no,
So, sir, how about appendicitis?
no,
Does your family have any gastrointestinal?
no,
Do you smoke, sir?
no,
How about alcohol?
no,
Okay, so, sir, the last thing I need you to avoid or urinate first to eliminate bladder distinction that might interfere with the abdomen assessment. So now my patient is already supine position because the supine position, this will allow the patient's abdominal muscle to relax. So, okay, sir, can you please lift your shirt and expose your abdomen? Okay, so now I'm going to observe the abdomen of the patient. Okay, alright, so now I'm going to inspect for the umbilicus of the patient to its color contour and locations. So now I'm going to inspect it. So for the next part of the assessment, I would going to inspect for abdominal contour or the profile life from the rib margin to the pubic bone. So I'm going to ask the patients to inhale, then hold. Sir, can you please inhale? While the patient has anything earlier, the bladder I will be measuring his abdominal birth or the circumference around the belly. Okay, now I will measure your thank you, sir. Okay, next is the foot if your abdomen is symmetrical. Sir, can you please raise your So now I'm going to auscultate, alright? I'll be ausculting for the abdomen this time. And first that I need to do is check is vowel sounds of the patients. Okay, I'm just going to first to get my stethoscope to auscultate, then disinfect it first. Okay. Okay, now I'll be switching the bell of the my stethoscope for auscultate for low pitch of vascular sounds on aorta. Okay, next is aorta artery and okay, next is the iliac artery. Okay, and lastly is a femoral artery. So this time I'll be auscultating the epigastric and of the umbilical regions for the venous foam, which is not normally here in those areas. So venous foam may be indicate the hypertension. And so for the last part of the auscultation, I'm going to check for the friction rub over the spleen and the liver using the diaphragm of my stethoscope and the left and right lower rib cage of my patients. The next part of the assessment, which is the percussion for the any resonant sounds starting from the right lower to the right upper. Okay, sir, I'll start. Okay, thank you, sir. Okay, for the next part, I'll be assessing the span of or height of the liver because I need to determine the lower and upper border to determine if I need to start in the right lower quadrant for my patients along the clavicular line, and then I will be percussing upwards until there is a change from the tympani to darkness. After that, I will ask my patients to take the breath and hold it. Sir, can you please hold here? Okay, thank you. Okay, thank you, sir. So next, I will be percussing from the upper right chest. So this will help me to determine the upper border by percussion from the upper right chest along the mid clavicular line. Okay, so I'll be starting from the navel. So next, I'll be repeating the percussion of the liver along the mid-external line or the center of the body. So I'm going to repeat again and start at top to the lower. Now that I already got the upper border and lower border of the liver, I will measure it using the tape measure. After measuring, I will be percussing the spleen of my patients to posterior to the left salivary line at the side of the patient. Next, I'll be moving downwards until you can feel the change or resonance with dullness. So there is another method in the percussion. The spleen to start from the anterior mid axillary line. So now I'm going to assess my patients to sitting position. Sir, can you please stand up? After that, I will do again a percussion to assess the tenderness, and I'm going to start the liver area of the patients. Okay. Now I will do it again with the same procedure for the blunt percussion in the kidney. So sir, can you please start the session? Okay, so after that, I'm going to do a test for abdominal distension, bulging. flanks or as this. So I'll be percussing across the flanks uh, until there is a change from the dullness, and I'll be marking the point as well. Okay, so sir, I'm going to start percussing across the flank. Okay, next for ascites, I will ask the patients into the sideline. So sir, can you please sideline position? Right. Sir, can you please block the sideline position? Okay, so for the last one in the percussion, I will be performing the five rituals. So I need to ask the patients to adjust the hand firmly down in the midline of the Thank you, sir. Now I will continue. Alright, so now I'll be applying a line palpation to assess for the tenderness and bulging, and I will start a right lower quadrant for at least 1 centimeter deep into the upper quadrant, then move to the upper left quadrant, then lower left quadrant. So, sir, okay, alright, the abdomen is non-tender and is no tender, and so now I'll be performing again on the right side and going in a deeper to evaluate for subtle masses. And if I find any resistance, I will take note of it. Alright, so if I find any resistance, I will need to use my manual palpation using my both of my hands to palpate the four quadrants. But for this case, there are no severe tenderness and pain related to the trauma. Okay, now I also compressing to depth 1 centimeter for all quadrants to assess for masses. So after that, I will be evaluating for the patient's umbilicus for swelling bulges or masses. Okay, so center is not also for potential herniations. Alright, now I'll be evaluating for organ to assess the position of abdominal organ for using my two fingers again. Alright, so tenderness is mild with a moderately strong but the regular process. Now I'm going to palpate for liver to assess for consistency and tenderness that indicate the vascular enlargement or tumors, and also as the patients inhale, and I'll be pushing my fingers upward and inward into lungs. So you can please. The lower edge of liver is a fold and it is smooth, and even also no tenderness is found. Alright, after that I will be palpating the honing, and I'll be curling my fingers like a fork, like this, to assess for the enlarge of the liver and ask the patients to breathe while I poke the liver area. that is smooth tenderness and is found that by indicating the hypnosis. So this time I will be palpating for the spleen, so I assess my patients into the sideline position, just like what I did earlier in sculpting. But now the patients will face in my side, and there are two methods, but I will use the second method by moving it downwards and forwards. So can you please? Alright, so the spleen is palpable, so you don't feel I don't feel anything, so no pain assess. And now I assess to spine position. Alright, so now I'll be palpating for the kidneys, and I'll be placing my hand the back to remove the support. Then my right hand will be a costal margin, and what I need is to inhale. Alright, so no pain at all. These kidneys are not palpable and no tenderness is found. So alright, after that I will proceed to the next part, which will be assessing the POSA site to assess that I will ask the patient to sideline position and ask the patient to roll into the left side. Sir, please proceed. Sir, can you please proceed? Sir, can you please tell me if it's hard? It's hard, sir. Sir. Okay, so there is no pain that may indicate inflammatory appendix, and uh, after that, the assess the supine position again. And next thing that I need to do is to assess for the obturator side by fixing hip into the patient's ankles, as well as rotate the leg internally and externally. Sir, can you please repeat? Okay, thank you, sir. Alright, so no pain is present that may indicate the irritation or perforated appendix. Alright, so after that, I will proceed to the last part of the assessment, which is to test for appendicitis, assess the rebound tenderness by palpating the appendix by 90-degree angle. So, sir, can you please expose your sir, can you please see if it's hurts, if I close?
No.
Yes.
No.
Yes. Yes. Palpable this time. Yes. Okay. Sir. Okay, now I'll be summarize the finding earlier. Now I'll summarize the all documentation regarding this assessment. Okay, sir. Now I'll be summarizing the finding earlier. So while checking your abdomen, there are no presence and deleted veins, so no stretch mark also. No lesions or any deleted veins. Also, the skin tone seems to look normal, and your abdominal movement are symmetric. Upon squatting your abdomen, I also observe series of the interment soft sleep, and which is normal. There are no fish or murmurs like sounds unheard upon squatting. Here are your renal, iliac, and femoral arteries, which is normal. Okay. So also the liver seems smooth and even consistent, which is good thing. And also for the last part of the our palpation, also negative for any signs and no presence of rebound and tenderness in your appendix. Sir, so I observed a normal normal finding in all the pressures that I have performed during the assessment. Okay, sir, can you please remember that the stress and anxiety can also the factor in the loss of your appetite, and you can also do different activities that can help to lessen your stress, sir, and anxiety, such as listen to calm music and doing deeper breathing exercise. So this data will be transferred to your physician. So do you have any question or clarification, sir?
No, I don't have any.
Alright, so thank you. You have been a wonderful patient, sir, and thank you for your preparations. And if you have any problem or